Anemia is when your body doesn't have enough healthy red blood cells. Red blood cells carry oxygen to your body parts. When there aren't enough red blood cells, your body parts don't get enough oxygen. This can make you feel tired and may make recovering after an operation slower.
So we're trying to find out the best way to treat anemia in patients after emergency surgery. Sometimes anemia gets better on its own, and sometimes severe anemia requires a blood transfusion.
We want to explore if different medicines might help patients get better quicker. The medicines we are interested in are iron by an injection into a vein, or iron plus a medicine called an ESA.
We want to see if these medicines can improve recovery for older patients who are anemic after having emergency abdominal surgery or emergency hip fracture surgery. We want to find out if these treatments can help them go home sooner and spend more time at home.
Every year, over 100,000 older people undergo life-saving emergency surgeries. Anemia after major surgery is common, and people with anemia tend to have a longer stay in hospital, slow recovery, more complications, and sadly, in some cases, are more likely to die.
If we find that we can treat anemia with the medicines used in this study, then we may be able to use them in the future instead of letting anemia get better on its own. This could also mean that we don't need to use as many blood transfusions for severe anemia. Blood transfusions are a scarce, expensive resource, and like any treatment, has small risks with its use.
It is possible that reducing the severity of anemia may mean patients are at less risk of developing complications after their emergency surgery. We hope more patients will go home sooner after their emergency surgery and spend more quality time at home because of these treatments.
It is also possible that these treatments don't make any difference to how well people recover after surgery. That would be an important finding too, as we will be able to tell doctors and nurses not to use them as they don't help and it's a waste of time and money. At the moment, we just don't know.
The only way to find out for certain is to carry out a study known as a clinical trial. That is what the POPEYE study is all about.